I'm Brittany Wilburn, and I'm the Executive Director at the Health Partnership, an organization committed to compassionately connecting individuals to health and well-being resources so they thrive. One of our key programs is our recovery program, and we host clean and sober events across Routt and Moffat counties, working with individuals struggling with or in recovery from substance use disorder.
Hello, I'm Chris Ray, a peer recovery specialist at the Health Partnership. I've been in recovery for over 4 years.
Hi, I'm Nelle Cashmore, a peer recovery specialist at the Health Partnership. I've been in recovery over 4 years.
I'm Lindsay Simbay, and I work for the Colorado Consortium for Prescription Drug Abuse Prevention. Before we get started, if you don't know what fentanyl is or you would like a refresher, push the pause button and head over to the link on the screen to view our What is Fentanyl video.
You cannot overdose on fentanyl just by touching it or being near it. Many people believe that simply touching fentanyl can cause an overdose. This isn't the case. A recent study looked at a healthcare professional who accidentally spilled fentanyl on his hand where he had a small scratch. Even with an open cut, he was able to wash his hands with warm soap and water without experiencing any signs of opioid overdose. This example shows that unless prescribed fentanyl patches that are specifically designed to allow the fentanyl to move through the skin barrier are being used, fentanyl is not easily absorbed through the skin.
The language you use when speaking about deaths from fentanyl matters. The characterization of some deaths as poisoning, while others are labeled as overdose, creates a moral hierarchy of victims of drug fatality, further perpetuating the stigma for all people who use drugs. The illicit drug supply is not regulated for potency or purity, meaning illicit drugs pose a potentially higher risk to all who use them, regardless of intent or history of use. An overdose, by definition, is the consumption of more of a substance than the body can handle without adverse side effects ranging from discomfort to death. When characterizing deaths due to drugs as either overdose or poisoning, you end up inadvertently insinuating poisoning implies either the drug or another person is trying to kill you, while overdose implies intent on behalf of the victim. We recommend being more intentional in the language we use so you are not perpetuating stigma. For example, try using the term deaths from fentanyl as opposed to overdose deaths or poisonings. This values the experience of individuals both knowingly and unknowingly using fentanyl and their loved ones.
There's a lot of fear surrounding fentanyl, which is understandable. Stigmatizing messages may lead us to think that touching fentanyl or inhaling secondhand smoke could result in an overdose, but there's no need to panic. If you come across an unknown substance, including fentanyl, it is always best to err on the safe side and use basic personal protective equipment. This includes using gloves, a mask, surgical or N95 if desired, and washing your hands with warm water and soap once you remove the gloves. If you touch fentanyl or suspect you have, make sure you wash your hands or the area that was exposed thoroughly before touching your nose, mouth, or eyes. If you come into contact with someone who is overdosing, time is of the essence. Regardless of PPE, give Narcan, call 911 immediately, and start rescue breath.
There have been some reports in the media about first responders becoming ill or losing consciousness after entering a scene that might or does contain fentanyl. Although it may be true that some of these responders feel ill, faint, or collapse on the scene, it is often due to a panic attack or an acute stress response. There are many causes for fainting, including fear, heat, dehydration, high stress, low blood pressure, and others. Unlike symptoms of overdose, many of these cases report symptoms more similar to panic attacks, like racing heart, hyperventilating before passing out, rather than nodding off, slowed breathing, and a heart rate. First responders have a difficult, stressful, and exhausting job as is, so it is completely understandable that someone may experience an acute physical stress reaction when being exposed to an unknown substance. However, it is important for us to alleviate these concerns by providing education around the inability to overdose from secondhand exposure to fentanyl.
For safety, it's important to assume that any substance not obtained from a pharmacy or healthcare setting can contain illicit fentanyl. However, there have been no verified incidents of fentanyl present in cannabis products in Colorado. If you are purchasing a cannabis product from a licensed dispensary, you do not need to be concerned with fentanyl in your products. The same cannot be guaranteed for products purchased illicitly because there is no regulation of what components are included.
If you missed the video about naloxone and how to administer it, push the pause button now and go to the link on your screen to access our Naloxone 101 video. If naloxone doesn't appear to be working, there could be several reasons for this. First, the person may not be experiencing an opioid overdose. They could have consumed another drug that doesn't respond to naloxone. Naloxone is only effective with opioid overdoses. However, please keep in mind it's always safe to administer naloxone even if someone is not experiencing an opioid overdose. If you have any doubt, administer naloxone, call 911, and begin rescue breathing. Second, the naloxone may have been administered too late. If someone has been in a state of hypoxia or not breathing for too long, naloxone and other life-saving measures will not be effective. Third, you may need to give the naloxone a little more time to take effect, or you may need to administer an additional dose. We recommend waiting 2 to 3 minutes between doses to give the medication time to take effect. Some people, depending on how much and what opioid they've consumed, may need additional doses outside of the 2 that typically come in the box.
I hope we've been able to provide some clarity about the myths surrounding fentanyl. It's always best to know the facts. If you would like more information about fentanyl, naloxone, peer support, treatment, or recovery, head over to thehealthpartnership.org to learn more.